Ghatan, does a dermatologist like you deal with hair loss or only with hair removal? I know we talked about that you guys do remove hairs in unwanted areas to make us look better. What about hair loss? Is that something you guys deal with or not?
Oh, definitely. That is a real dermatological problem. We do see a lot of patients with hair loss. There are many reasons for hair loss, or what we call alopecia, which is another term for hair loss. There is the male pattern hair loss or female pattern hair loss, which are the most common type in both men and female. And there are alopecia areata or other kinds of hair loss. The main thing is we don't like to just throw a medicine at a person. We want to find out what the cause of the hair loss is. We want to know what it is that we can do to help the patient. If there's any laboratory tests to be done, or biopsies, skin, or hair being sent for evaluation, to better understand what the cause of the hair loss is. This way we can give them the proper treatment.
Okay. Now, let me ask you. So for instance, I'm sure ladies have hair loss also. We all get a little worried when the shower becomes more full of hairs, even though it has, in my case, been so since I remember, and ever since I'm married, I know my wife lost some hair, but I don't see that she loses any hair. So she still seems to be fine. But so is there a cause for worry that you lose, or is that normal that you lose a few hairs in the shower and you notice it? Is that kind of a normal procedure anyway? When should a person start worrying about that something is wrong and he might start getting bald?
Well, it is normal to lose about 50 to 150 hair a day. That is normal, because the hair goes through a cycle, goes through a growth cycle, a resting cycle, and a falling cycle. So it's a cycle that all of us go through. Now, if the person gets to the point that there is more hair loss, more than usual, and seeing that the volume of the hair on the scalp has decreased substantially, or sees patches of hair loss, one side or another side, then that is the time to have it checked out. If there is part of the eyebrow that's not growing, or a hair loss in the beard area, and that is something that has to be checked out.
And it's a skin problem, basically.
Yes.
I see. And so is it usually that you do something to make the hair growing again, or is hair replacement, like, just giving, taking your own hair and putting it on, or taking, strange hairs or whatever, putting it on? Is that part of the treatment?
Yes, those are options of the treatment, depending on the kind of hair loss. For the male pattern or female pattern hair loss, there is hair loss in the front, especially. It's possible to take hair from the back here and graft it to the front, and they usually stay for many years. Each follicle on the scalp is programmed differently. So in the front, the follicles are programmed to fall earlier in life, whereas the ones in the back of the head are programmed to fall at much later age. So that makes transplant a very viable option for people who have especially very substantial hair loss. But before going to transplant, there are other options. There are topical medication, oral, herbal medication, and most recently a laser treatment that can improve, stop, and maybe regrow some hair. So these are a lot of new advances in hair treatment.
Wonderful. Now, I don't know whether that is totally off topic, but what about getting gray? Does that have anything to do with the skin also, with the dermatologist? Can it be stopped, or is it just it's happening and that's it, live with it?
It's happening. There may be some chemicals that one can take to stop the spraying, but the harm that's going to be coming from that chemical is probably much worse than having some gray hair.
Got it. So rather than coloring them, if you really want to, that's about it, right?
Yeah.
And is coloring your hair because there seems to be like I don't know, a huge amount of ammonia in it or whatever. Is that kind of like, you know, going into your brain and make your brain damaged or something like that, or not really?
Well, there was concern about cancer from hair dyes years back, and there were some issues. I don't think at this time there's much to worry about, because the newer hair dye don't have the previous formulation where there was a concern.
I see. Oh, that's good to know. That's good to know, just in case one of these days my good-looking hair gets gray, which it starts doing so, which is exactly why I asked you the question. I gotta know. Thank you very much, Dr. Ghatan. Very informative.